Hello, Dr. Gupta. Thank you so much for joining me on Culture Chat today.
Thank you for having me.
Yes, well, I am very, very interested in speaking about you because, of course, you're here to talk about the COVID-19 vaccine, which is kind of on the top of everyone's minds lately and has been, a bit controversial. Before we begin, I will share that I've already had my first dose of the Pfizer vaccine, but I do know that a lot of people are very hesitant and they're very afraid of getting vaccinated. So I kind of turn it over to you and your expertise into, what do you say to people who are very hesitant? And then we can kind of get into the details of the technicalities of the vaccine.
Absolutely, and thank you. I think it's very important to have a discussion. That's the first piece. And, and when we discuss any new drug, much less a vaccine, I think it allows people to know the facts, have more information in their armamentarium in order to make good decision. That's the first piece. We also have to understand that it's okay for people to be a little hesitant, to want to ask for more information because this is something that they're putting into their own bodies and sometimes even the bodies of their loved ones. We also have to be clear about the facts and the tremendous, burden of this pandemic that has happened, not just on Americans across the nation, but across the globe. And we've had millions of people die in the last 12 months. At the same time, there has been some good news from this tragedy. The good news has been that this particular pandemic has allowed us to look at new platforms of developing vaccines and rapidly have that technology move forward. Working in March of Dimes, we took a lot of pride within a few years that we were able to fund and develop the polio vaccine, 1955. They called that a rocket speed at the time because it was almost nearly impossible to develop in a matter of just a few years, polio vaccine. We're the same institution, and we feel that this happening within months and then across the globe, various companies competing with each other with new technology, demonstrating their data, doing things as transparent as possible. And the regulators taking a really good proactive approach to understand the consequences of not doing so. Just instills confidence that this is the way it should be in a tough pandemic. We should be looking at data. We should be demanding high level of safety and effectiveness of any product that we're going to put into our bodies. And then we should be proud that we have such candidates today, that millions of Americans and hundreds of millions of people across the globe have taken advantage. And we're seeing a really encouraging data from post-marketing or post-vaccination data that's coming out.
Yeah. And, I'm here in Orlando, Florida, and they just made the announcement that 18 years and up is going to be opening in a couple of weeks. And, in the earlier days of January, it was 70 and up here. Every state is so different. And I talked to friends across the country and they're like, oh, they're still on the 50. And maybe you could speak a little bit to that, because do you think that affects people's hesitancy? Like, well, not everyone's getting it everywhere, and it's so variant in so many different places. And I know this has been a challenge, and despite the fact that we Americans are used to right now, right away, let's get this done. But I think it's actually gone pretty amazingly fast for something of this nature where we're trying to vaccinate so many people. But do you think the fact that it's so variant across the US in who's getting it, who has access, that makes it, people more hesitant?
I think one of the things that has not gone so well across our nation is that we've not had until now, a really good, robust, sort of description of what the challenges are ahead of us and a uniform approach.
Right.
So what we've seen, as you mentioned correctly, is all 50 states and our territories across are literally using the same science and data to roll out their own programs and plans. And in one state, you can maybe have the vaccine available to people with chronic health conditions, becoming available for those, 45 years or older. And in Florida, you're almost at the precipice of making it available to literally any adult.
Mm-hmm.
It does become a little confusing for people because science is there to do that, but then you have to match that up with the ability to have supply, making sure that it's vaccine is just not it. You have to have so many other things: vials, band-aids, alcohol swabs. And then the logistics of organizing mass vaccination clinics. So it's a lot, and public health experts and personnel across the country, as well as pharmacies and others, are doing a wonderful job, and they stand ready. So, we've had various states function literally independently in so many ways, and it does cause a little bit confusion to people to think about, well, especially those who are living in border states, then should I go to this place or that place? Some allow only state residents, others allow anyone to come and get the vaccine. But I think we've learned a lot of lessons out of this, and this is one of those lessons that we need to have a sort of national approach to a global pandemic. In fact, I'll go far as to say we need to have a global approach to a global pandemic, because what's happening right now, I think there's a little bit of nationalism that is going behind the vaccine distribution, hoarding, as well as the shot in the arms, because it's very important to understand that what a global pandemic means is, if other countries are still having outbreaks, then we're not safe. Mm-hmm. If one or more of our states or areas within those states are having outbreaks, then we're not safe. So it's very important to take an approach that we must address this in the totality, in a coordinated and unified approach.
Yeah, I completely agree. I feel like there is a bit of, there's people who are so excited to get the vaccine, and other people who get very jealous, like, we're not getting it here. And it starts to cause a little bit of dissonance. And then you look at that statewide, citywide, then country, across the world. And like you said, this is a global pandemic. This affects everyone. And so if it's affecting someone else, it still could be affecting you and your loved ones. And I think that is something that's not actually talked about enough. So thank you for, kind of emphasizing that, because I think we're so, and not, wrongfully so, we're so wrapped up in how this is affecting our day-to-day, the kids who can't go to school, or I haven't been able to go to a restaurant, or all these things. And there's a lot of especially in the American culture, and so I think that plays into forgetting that, if XYZ country is also not getting enough vaccines, we are not going to still be able to coexist peacefully, right? And be able to do all the things we all loved, which is travel and be together. And so maybe you could talk to me a little bit about some of these words that people think they understand, myself probably included, but maybe don't. Like we hear there's right now, we've got the Pfizer, the Moderna, and then Johnson and Johnson. And then of course there's the very controversial AstraZeneca, but the concept of efficacy, because I feel like people look at that percentage and they just see it as, these are 3 apples and this one is, this much rotten, this one is the freshest, and that's it. Like it's not as black and white as that, though. And so perhaps you could kind of clarify that for our listeners.
So thank you. That's a great question. And that really gets us into the direction of what are these vaccines. So, without going into a lot of detail, this is a phenomenal platform and technology use that we have. These 3 vaccines that are currently approved in the United States, the Pfizer and Moderna, the vaccines that have the platform of messenger RNA or mRNA, they're to be given in 2 doses. And, the Pfizer one is 3 weeks apart. The Moderna one is 4 weeks apart. And then we have a Johnson Pharmaceuticals vaccine that is really uses the double-stranded DNA, and you could utilize that as a one dose. Now, the efficacy is different. So one has the two, Moderna and Pfizer, have efficacy in the 90s, and the other one has in the 70s. But here's what's important. If I was to pick, I'd rather have, 4 million people get the 70% than 1 million people get the 90% efficacy. Why is that important? Because the task at hand is to develop our community immunity, or what we call herd immunity. The more people can get these, proven vaccines that are showing remarkable safety data so far, the quicker they can do it, what does that allow? Its time is very important, as I'm saying this, because the weather is warming up. And of course, in Florida, it's already warmed up. It's the envy of so many people. And we have mutations across the globe that are racing, that could potentially cause difficulty in the vaccination campaign. And the last piece is, we all want to get out. We all want it to get normal again. And the best way to do that right now is to make sure that we get a vaccine in a arm. It does not really matter which one it is. In fact, if you're the kind that likes to get one shot and move on, do that if you have a choice. If you like to wait, get one shot and then go back up and get another shot, do that. So I want people to really understand and have confidence that it's not the issue of efficacy if many and many of us are taking the vaccine. It's really an issue of race against time right now to suppress the mutations that are developing. And as we want to get out, we do not want to spend this summer that's coming and looming housed in like we did last year. And the only way to do that is to follow your health department's guidelines. And as soon as it's available, get your vaccine. And we will be then able to have July 4th like never before.
I think the fireworks could be sold out this year.
Yeah.
So thank you for clarifying that. I think another hesitancy, politics aside, because obviously something like mask wearing became political versus health policy, which is ridiculous in my opinion. And I don't think we want to get into that rabbit hole. But the thing is, it is a matter of health. It is a matter of protecting yourself, and by doing so, protecting others, right? And we have that responsibility as a worldwide pandemic that we are, trying to help one another, and so I think, aside from the people who have made this kind of political and said, well, I'm never going to get vaccinated because that's my right or whatever, and that they don't feel like they have that public responsibility. But there are people who maybe have hesitancy because they think it's something that's so new and they don't know if there's side effects, or they heard someone that had the side effects and there's like, I don't want to be laid in bed for 2 days, or I don't want brain fog. And also I want to wait longer because maybe there's going to be long-term effects we don't know about. And there's that fear. And I feel like that's a valid fear for people in something that's so unknown. This is such a new virus. And then now it's a quote unquote new drug. From my research, I understood that, we didn't start from ground zero. Like there were already vaccines for strands, but I'm not even going to try to explain that. And I'm going to hope that you're going to do a really great job of it, not me. But
Absolutely. I'll start by saying that people who are deciding no matter what happens, they're not going to get the vaccine. Well, we still have to protect them, right? So because we have also, in addition, a lot of people within our communities, within our families and our loved ones who may be suffering from cancer and may not be able to mount a response, as an example, or some other immune deficiency condition like HIV that may not be able to mount an appropriate response from the vaccine. So we have to protect all of us together. People, who are thinking, well, it's the side effect. Well, I've had it. And the fact of the matter is, yes, there is always going to be a local sore arm. Because the vaccine is so effective, you can get the feeling of a flu-like feeling meaning you can have a little fever, you can have body aches. The virus, the vaccine does not have any virus in it. So, but your body, when it fights and produces those antibodies in response to the vaccine, to produce and keep its memory alive so it can fight anytime it comes across the virus, that's when you feel those symptoms for about 36 to 48 hours. And it's important to know that's almost a sort of sign of the vaccine is working. So and it's not a major illness, and it's important that we're informed, because when you know that could happen, especially with the second vaccine, it is planned accordingly.
Oh, if you're speaking, hold for 1 second. You're breaking up. Jake, mark this for edit. Uh-oh. Sorry, can you hear me?
I can hear you. I think
Oh, okay.
we're back.
We're
Yeah.
back. Oh, all right. If you could maybe just pick up with from where you were talking about if you have that hesitancy. I'd rather just cut it all together again and make it nice and clear.
So for if you do have hesitancy, just know and get acquainted with the potential side effects of the vaccine. I've had the vaccine myself, and yes, the second dose can cause you to have a little sore arm for a day or two. And you may even have a little fever or a viral-like syndrome, but know that the vaccine does not contain any virus. In fact, having minor symptoms in the first 48 hours is a sign that the vaccine is working. It's creating the antibody response in your body that you want it to, so it can protect and fight off any virus exposure in the future. So it's important that when we are traveling, that we know from the TSA numbers that we've had now 1 million travelers in airlines for 2 consistent weeks across the nation. And there's a lot of people who may be having to travel for work in other places and flying included. So it's going to be important that we are all vaccinated and protected, because it does take 12 to 14 days after your second dose to get the full benefit of it. So it's not like I take the first shot now, I'm protected. And it becomes very important that as we take the vaccine, we continue to social distance ourselves, we continue to wear masks, avoid large gatherings, because what we are trying to do is something good for ourselves, our family, but also our community. And as a result, when more and more of us get the vaccine, then the virus has fewer and fewer Americans to infect. And in that case, that's when we know that we have begun to win this war.
Oh, okay. And how would you respond to people who are worried that there are long-term side effects or things that could happen from the vaccine? What do we know about that?
We have no evidence to suggest that there could be any side effects long-term from the vaccine. In fact, we have so many other vaccines that exist today, whether it's for the regular flu or for a number of vaccine-preventable diseases. And we've studied these. The mechanism is quite similar, ultimately to protect, which is through creation of antibodies. And we know vaccines work. They have been one of the public health advances that we're proud of on the globe. We've been able to eliminate diseases because of this. We've been able to control epidemics because of vaccines. So, it's one of the remarkable progress and achievements of the 20th century, believe it or not, that we've been able to live as long as we have been able to for countries all over the world because of vaccines.
Yes. Yay, science. Should I be worried though if I don't get a reaction? Like some people go, "Oh, I felt nothing at all, like barely even the sore arm." Is that a concern or?
No, I think different people react differently, and I certainly didn't have any reaction after the first vaccine shot. So, and I had some after the second shot. So it just depends. There's so many factors, but you shouldn't be because these vaccines are very sophisticated, but they're also being kept well under the right temperatures and being produced. I mean, every time I go to a health department that is administering these or pharmacies, They're doing a great job, and we need to continue to do our part in the community.
Absolutely. And so you were speaking earlier about, of course, that, you and I here, of course, believe in vaccines and think the that it's really enabled us to have this longevity and to have the society, the modern society that we have today. But a lot of people say, well, I get the flu shot, but then I still get the flu. So why should I get the COVID? Is it really going to make a difference?
Yeah, first of all, let's talk about the flu shot. If you take the flu shot, typically the effectiveness can vary each year based on what the matching levels are. But what we know for sure is this: the flu shot reduces your ability to have severe disease from the flu. And secondly, it actually helps prevent death. So flu shots prevent not just getting the infection, but if you were to get the infection and because there was not a good match, it actually has significant data showing that it reduces your ability to have poor outcomes, including death. In fact, the COVID vaccine, when the data has been looked at in terms of clinical trials, it has had a remarkable effectiveness in preventing death, sometimes to zero. So it's not just the disease, but what the ultimate purpose of vaccine is to prevent death and poor outcomes. What is most difficult is when people end up not just with the infection, but they end up in ICU, they end up in a ventilator, on a breathing machine for days or weeks or months, and they either remain crippled for a long time or they can then pass away. And it's a terrible consequence. This is one of the more important pieces of the vaccine that it prevents very effectively. So it's important that we know that the vaccine is important to get the vaccine, but also the worst outcome. I mean, we could, I wish we had this a year ago. We could have avoided hundreds of thousands of Americans dying as a consequence, and so many more being hospitalized for so many prolonged periods of time. So hopefully that with the vaccination, we can prevent that as well as curtail new infections.
Yeah. And I mean, there's so many things that we all look back in hindsight and think that we could have done differently, different steps we could have taken, but we can't go backwards. We can only go forward. So in going forwards, though, perhaps you could even share one. I don't understand why people aren't afraid of the whole death outcome, but I think there are also things that people don't get to hear enough about because they know someone that got it and they were just, sick for a few days and then they were fine. Because like you said, with even just getting the shot, everyone has a different reaction. And getting COVID, everyone has a different reaction. And there's so much based on your age, your comorbidities. There's so many factors into how it it affects each person. And I think that, like I said, I don't know how the proof of people dying isn't enough, but perhaps you can speak a little to some of the longer term things that could also happen, that even people who get it and they recover immediately, are there things later on in life that they should be concerned about? Because I know I've been hearing pieces of that, but I just want to try to bring awareness to people that, look, it's not like the flu. You don't want to get it and recover. Like, you just don't want to get it, period.
That's a very insightful and important question, and I'll share some of my personal experiences because of that question.
Please.
So, I have sons who, just like so many Americans out there, have worked in their thinking through this concept. And one of the things that frightened my young son was the following: is the fact that, hey, if I got infection from COVID, I would not only potentially be at risk for serious disease at the time, and if in the best case scenario I got better, I don't know what the long-term effects are of this infection. And it could potentially impact me, handicap me for the rest of my life. I don't know the outcomes. And therefore my son decided to be one of those candidates that wants the vaccine. But on the other hand, I will also say this, that, we have no data as to how long the natural immunity, quote unquote, stays from a COVID infection, as opposed to a vaccine, which has been looked at, and we are continuing to monitor and look at the long-term effectiveness of the protective antibodies and immunity. So it's a difference in terms of both. We have science behind the vaccine. We don't really have science behind natural immunity. But on the other hand, we know very little. I think what you're going to see in the next several years to come is really the science develop on the potential long-term impacts of infections, COVID infections. And I think, if we get a choice whether to risk it or not, I think common sense would dictate that let's not risk getting the infection.
Hmm. And I would like to also ask because, like I said, my parents got vaccinated in January. I'm on my way to get my second one. And it's a question I guess you can't really answer yet because we have to wait and see. But what does that look like? Like, how long will it last? How do I know when, oh man, I need to kind of go back to being safe? And I know that being vaccinated is not a free pass because it's very clear you should really still only be around other vaccinated people if you're going to take away some of those safety precautions. And if you are, it's only like one household. I'll link that here. There's a really beautiful CDC chart that's visual that really pretty much shows like this is not a free pass. But I think the biggest thing too for hesitancy is, well, if I have to get it now and I have to get it again in 3 months or 6 months, or is it really worth it, or does it last, right? And so maybe you could talk a little bit about that.
Yeah, what we know right now is this: that once you get your two, doses of vaccine or one case of Johnson Johnson, you are able to take, the link will show certain measures that free you up, allow you much more independence than previously in an evidence way kind of way. It also allows us to interact, get out there and during summers and be able to really work within ourselves and with ourselves. So more and more Americans who get vaccinated, then we're going to be able to interact a lot more. And hopefully, as we learn more about the long-term impact or the immunity, our hope is that we are able to defeat this virus by just the fact that we have these vaccines now. More and more Americans are getting the vaccines. We're getting very close to, meeting the 100 million Americans mark. And at that point, we have much less of the virus floating around. So if we can not have enough virus floating around, then obviously it becomes much more convenient to open up more. Now, if you think the converse, there could still be areas that have outbreaks, and ultimately the mutations might play a role in making it very difficult. And we may have, whether in the United States or other places across the country, more shutdowns, which disrupts the very basic nature of who we are, but also the economy, the local economy. So it's very important, while not knowing what the future might hold in terms of do we need more boosters or not, I do think it's what we can do for ourselves right now, today, here and now, is to make sure that we get protected so we can get more and more Americans in a cohort that also means less and less spread of the virus. And as we get on our way to, sort of defeating this particular pandemic, I think it will allow us more quickly to open up and avoid those, shutdowns that we're all like already done with.
Yes. Yeah, everyone's over that for sure. I know I said that I wasn't going to look to the past and that I was focusing on the future, but I do feel like, in my opinion, there are so many things that we could have done in terms of our government helping us out through this. And I know science jumped in it right away, was trying to get the vaccine developed. There was a lot of things, but looking at other countries that are still in what I consider to be a little bit of the dark ages and denial of this pandemic, it's like, for example, Brazil, right? Because I have students in Brazil and they're just frustrated and sad and upset, and we're like we're on the road to recovery. I'm like, yeah, 18 and up can get vaccinated here, and we're moving along. Were there things that could have been done in the past? Meaning, now, how worried should we be about all these mutations and new strands? Because if we had done more then, would there not be as many new strands now? And that means the action we take now is also to prevent those then, if that even makes sense.
That is exactly right. That is right on the money, right? And because, some of the countries, as you mentioned, Brazil, not taking a responsible approach right now could spell disaster for everybody else in the future. Just like localities and counties or states not taking action now within the United States could spell disaster for the rest of us. So we are all linked at the end of the day, and that's why a unified approach is so critical. And it's important to ensure that more and more countries, as well as more and more cities and jurisdictions across this country, are encouraged to follow this path, because that only not threatens them not doing the right thing, but it threatens the rest of us. So I think there's a lot of learning lessons that will come out of this. One, as we began our discussion with, is we must have a global approach. We must have certain set of principles that we can all agree on, and one of which is to minimize deaths and avoid suffering, and follow the evidence. So it's something that we have to develop our infrastructure better. We have to make sure that we have more ability and tech involvement to be able to monitor in real time how good or bad we're doing in terms. We need to have very early onset and dissemination of testing appliances and tracing infrastructure, human resources. We need to make sure that we have enough vital infrastructure like masks and other things. Masks aren't the only thing, but gloves and other aspects that are in reserve available. Same thing with ventilators. So there's a lot of work to be done moving forward if we are to learn from this pandemic and move forward. But yet I think, there's a little bit of work left to do before we see the light, or get into the light from the tunnel. And then there's a lot of work to prepare for the next one, because rest assured, it's not a matter of if, it's a matter of when another one of these will be faced with.
Yeah, and I don't envy you and all of the other healthcare and scientists that are the ones that are literally putting out fires to see new ones pop up. And it's like you said, it's going to be an ongoing issue into the future. And so, thank you for explaining and sharing all of those things of what needs to be done from, the scientific approach, and as well as a infrastructure and logistical approach. But I wonder if there's more that you can share possibly about us as citizens. Are there more things that we can be doing as just mere citizens and mere humans that don't get to work on the scientific approach of it? But what can we be doing other than getting out there and getting vaccinated?
One of the things that this pandemic has unveiled is the underbelly of the inherent disparities or inequities that exist across our communities. It's, if nothing else, it's a lesson to us that when trouble strikes, we see it really unfolds. The frontline workers that are really the champions that have had to oftentimes decide between, risking their lives to be infected or putting food on the table for their families. And there were some that were just fortunate to have a job during this time. I think we should really take a somber moment to understand the suffering that has undergone. For those of us who are and have done well, we need to recognize that and help support our communities. That's the best thing we could do right now, is to support those who were or are going to be unable to support themselves because of this pandemic. People are seeing challenges with their housing situations, with their food insecurity, transportation, and sometimes just simple racism. It's very important for us to, if we learn nothing from this pandemic, I think it's the humanity, the call of humanity. We can all, just take an oath that we're going to be better residents, better citizens, and better people at the end of the day. I hope that being quarantined, sitting in our own homes for months at a time, has allowed us that time to do some introspection and self-reflection, and the longing for community and the longing to be back with friends. I hope that stays for a while. That expression of love, expression of understanding that while we pride ourselves in American exceptionalism, we do need our communities and to be together. And we've sort of felt in the last 12 months how hard it is. We've had a tremendous challenge of mental health, isolation, depression, often suicide and attempts. So that's an example that there's so much more that we need to do. And I hope if something positive comes out of this pandemic, is that we're all human at the end of the day, and we're all connected at the end of
Yeah.
the day. and we need to do more we can, as much as we can for our communities.
Oh, so well said. And I didn't want to bring it back to doom and gloom, but you had mentioned something earlier about, well, we do need to be prepared for the next pandemic because there will be another one. Um, do you feel we will be more prepared based on what we just went through for this last year?
I think so. I have a lot of confidence in our ability as a nation to bounce back. I'm very bullish that we're going to learn from this, and we're going to be much more smarter and much more invested into the future in regards to being prepared for a threat like this.
Yeah. And just to pick off one of those things that you mentioned, because I did notice that, some countries did better than others in containing the virus and, hey, you're not allowed onto our little island. And so we're going to stay protected. And that worked, right? Because it was a matter of traveling and people just, this is how it spread, right? Um, I think tracing is not spoken about enough because it seemed so effective in so many other countries. I think it was like Taiwan and Singapore and some of those other places that it just seemed, yes, there was still traveling happening, but there was tracing and quarantining for those travelers. And that way it wasn't the whole city that had to quarantine and feel locked down and be upset, and the economy. I think there were other things. Do you think that could work here in the United States?
Maybe absolutely. I think there were countries, as you mentioned, like Taiwan, like Singapore, that knew what they were doing and how to do it, and they came up with it and they stuck to it. They did not second guess themselves, and they continued to improve their processes. It was a unified approach, and I think that's what we have to have, as opposed to a 50-stage strategy, which is important. We need to figure out from a technical aspect of this, how can we really focus on developing. One of the things we didn't have was the basic fundamental infrastructure to expand our tracing. We have had seen a declining public health infrastructure for over a decade, actually, when this pandemic struck us. I have been previously a local health officer as well as state health commissioner. And so I could tell you the dollars was tremendously declining. And that allows you not to have that reserve in infrastructure. So we're going to have to develop that. We're going to have to invest in our systems, in our people, to ensure that we have a really good tracing, tracking, as well as an infrastructure that allows testing to be very quickly applied.
Yeah, because I think all the resources, especially in this country, obviously, so we have the most vaccines. I think, of course, we needed to contain and get that out there and help save people's lives. But I feel like it's because we missed the preventive step, like it just was skipped. And I think a big part of it is that this administration is taking this so seriously and saying, hey, here's in the first 100 days, this is what I want to get done because we dropped the ball. And but this is people's lives. This isn't just, oh,
No,
this is a big deal. And
yeah,
I think
and
we missed a thing.
yeah, and whatever concerns you have, privacy concerns and relative autonomy, they can always be respected, and we can get work done. So it's the concept of being able to respect our freedoms and actually save lives. That's what's important for us to do. So it's important that when we're talking about some of these mechanisms, you can do them with safeguarding the protections that we so believe in and honor in our society.
I
So
agree.
it's our ability, and I'm very both optimistic and believe that we're going to be able to do that.
Yeah, and I'm glad you mentioned that because I think people do get that paranoia. And my understanding is if you even own a credit card, like that amount of information people have on you is more than even what this contact tracing could do. And if it can save lives, I think we need to just kind of connect those dots so people understand we don't want this to happen again on the next pandemic, which will happen, right? Like you said, science is moving quickly, but so do these viruses, and they mutate and they change and they find a way. Life finds a way, and disease finds a way, and we have to constantly combat that. I know you only have about a minute left, so I'm trying to get in as much as I can with you because you're such an amazing resource. Thank you again. It's kind of controversial, but we've talked about we want everyone to get vaccinated. Those who can't, for certain reasons, like you said, they have cancer or they're under treatment, and it's not advisable. Like people are talking, other countries are doing vaccine passports where you can't travel to certain countries, or you can't get on planes, or you can't do things. What is your take on that in terms of the right now? Because of course the future is the future, but the right now, how do you feel about showing proof to travel?
So here's a reality check. When I got my 2 doses of vaccine, I have the ability to go online and have a record that I had gotten the vaccine. So I have that ability. Everybody who's getting their vaccine does have a vaccine card. The question is, should we use that as a tool to distinguish people between people? And I think that's where more and more Americans getting vaccinated, more and more, resuming our transportation, resuming our systems is important because, I don't think we need to necessarily separate people out for those who've gotten the vaccine versus not, because there's a lot of reasons for people unable to get the vaccine, right? So it's access issues, it's transportation issues, it's actual medical conditions issues. And we work very hard to not create a situation where people feel that somehow because they don't have a vaccine, they're going to be discriminated against for any reason. So
Mhm.
I think it's an importance of inclusiveness and having an inclusive society that we need to think about what are the best ways. And one of the best ways is to make sure more and more Americans are vaccinated. So we have the community and herd immunity. So we don't have to worry about the vaccine passport. Of
Yeah.
course, if that's required as a condition for you to travel internationally, that's up to that country, and you have that ability to demonstrate that.
Mhm.
But
Yeah, I mean, I went to Brazil and I had to get the yellow fever shot, which was pretty intense, I have to admit. But when we were coming back through different places, some places wouldn't allow you there in the islands if you didn't show that you had had the shot because you had been to the Amazon, right? And so it's not something new. I think people think, oh, this COVID-19 has caused all this crazy. And I'm like, this is not actually new. There are certain countries that are very careful because they have such a small, tight knit population. If there was an outbreak, it could wipe out the whole island, right? And so you have to also kind of look at and understand it's not always about you. It's also about the other communities. Okay, well, I know that uh, you have to go and continue to save lives and do what you do. Is there anything else you would like to share with our listeners in conclusion?
I would just say that once again that we have an opportunity in this country after quite a bit of time to demonstrate to the world that we can lead the globe on getting vaccinated, getting rid of this virus from our shores. We've done this in the past with polio. We were one of the first countries in the 70s to eliminate polio from the United States. Let's get back to that unified approach. Let's take this as a national way, our patriotic duty with coming 4th of July to make sure that we are all able to enjoy outdoors and have fun. So let's get on with life.
Thank you so much, Dr. Gupta. I learned so much today. Really appreciate you taking the time to share and clarify and, ease our concerns about the vaccine and educating us on COVID-19. Thank you.
Thank you, Mimi. Appreciate it.
That's all for today's episode. Thanks for listening to the Sifu Mimi Chan Show. Please subscribe and rate my podcast on your platform of choice and leave a review. You can become a patron of the show at patreon.com/SifuMimiChan to help keep this podcast going. Follow me and interact on social media at Sifu Mimi Chan on Instagram, Twitter, or Facebook.